nearly 1,800 Nevadans in the hospital tonight because of COVID-19 across our state. And local hospitals are bracing for the full impact of the holidays.
Yeah, in fact, one hospital has already issued a disaster declaration because of an influx of patients. And 13 Action News reporter Jeremy Chen right now is live near Buffalo in the 215 with all of this and what it means, Jeremy.
Yeah, Todd and Tricia, it was here at the St. Rose Dominican Hospital in Southwest Vegas where that disaster declaration was made. It also comes as we're approaching 2 weeks from the New Year's Eve celebrations for potential COVID cases to perhaps pop up or hospitalizations. However, area hospitals we reached out to say they're prepared for any post-holiday surge.
The pandemic has tested Valley hospitals like never before, with COVID patients continuing to show up. One Valley hospital issuing a disaster declaration. St. Rose Dominican Hospital in Southwest Vegas saying it had an ICU occupancy of 137% and treating more than 70 COVID patients this past Saturday. Hospital staff saying it has experienced a steady increase in critically ill COVID patients and limited supplies. Sunrise Hospital also feeling the pressure. The chief medical officer there saying it's at full capacity with about 700 patients. He says they have been able to beef up medical staff.
We've been fortunate to add 64 traveling nurses. That has in itself allowed us to take the pressure off of the system and reducing our patient and nurse ratios.
They've also created a specific treatment center outside to be proactive with COVID patients.
The purpose is to treat COVID patients in those early stages to prevent hospitalization, to take off that pressure.
UMC is reporting 86% capacity, saying it's ready for any post-holiday surges. Mountain View Hospital saying it is caring for a large number of COVID patients. UNLV health professor Brian Labus says Valley hospitals continue to see high levels of capacity, but not to the level of issuing a disaster declaration.
Still full, we just haven't fortunately crossed that line to where we start to have to decide how do we take care of people.
Now, doctors at the hospitals we reached out to are asking people to continue following the guidelines to prevent the spread of COVID, like washing your hands and social distancing. They're also asking people if they have to go to the hospital, like for breaking their leg or having a very serious illness, to still come to the hospital. We'll have more on that coming up at 6. Jeremy Chen, 13 Action News.
All right.